Listen, Read, and Write, a review of the basic study skills. This course is divided into 3 parts: taking, organizing, and studying lecture notes, reading, and written and oral reports. This is Part 1. Part 1 has 3 sections: morale, the lecture, and after the lecture. Some study skills manuals begin with motivation. I prefer to talk about morale because it includes confidence, which is very important. Morale is what keeps you going when the going gets tough. Confidence. I like to say that the courses students fear most are the easiest ones. Studying for tests that require memory in detail may be time-consuming, but it's very simple if you know how. Learning study skills can greatly improve a student's confidence. Interest. Above all, a good student is an explorer. If a course seems pointless, remember that somebody had a reason for including it in the program. Ask yourself with an open mind what its purpose is and how it might help you. Health and fitness. Obviously, time doesn't permit a discussion of every aspect of health that can affect a student's performance. I'll mention 2 that are often associated with academic problems: reading deficits and mood disorders. Reading deficits are very common with at-risk students. Reading specialists always refer students for examination by an optometrist. Reading deficits are often called dyslexia, but dyslexia is only one of the reading problems that hold students back. I'm not a reading specialist, but from personal experience, I can say that the book Helping Your Teenage Student by Dr. Marvin Cohn, who was a psychologist and reading expert at Adelphi University, is very useful for identifying and solving common reading problems. The book is also a good source for improving other study skills. While this book is out of print, copies are still available through sellers like Amazon. You can also get a copy through interlibrary loan. There is clearly a relationship between academic failure and mood disorders. Warning. Authorities on the subject of self-help for psychological problems are agreed that self-help has limited use. The works mentioned here are not intended to replace office visits. The consensus among experts is that severe depression requires medical care. Mild depression should be regarded as a serious illness, just as the early stages of an illness such as diabetes should be regarded as serious. Doctors say that sudden acute anxiety calls for medical examination, if only to rule out another condition that might be causing the anxiety. If you think you're about to harm yourself, call a crisis hotline, an emergency number such as 911, or your doctor. Medical care often begins with a visit to the primary care provider, such as the family doctor. A patient who complains of depression may be given a standard screening test. A very brief standard test is shown here. It consists of 2 questions. Over the past 2 weeks, have you ever felt down, depressed, or hopeless? Over the past 2 weeks, have you felt little interest or pleasure in doing things? This is a screening test you can take online. The Center for Epidemiological Studies Depression Test, R for Revised. We should remember that the family doctor is not a mental health professional. Stephen Ilardi, the clinical psychologist and researcher whose book on lifestyle and mood is mentioned in this video, says that most failures with antidepressant drugs are associated with prescriptions written by general practitioners. These drugs are also prescribed by psychiatrists, physicians who specialize in psychological problems. A psychiatrist may provide therapy to a patient, but often psychiatrists see their patients in brief sessions to see if there should be a change of prescription and leave therapy to a clinical psychologist or another psychiatrist. The shortage of mental health professionals who specialize in treating minors and the reluctance of many physicians, especially general practitioners and pediatricians, to prescribe antidepressants make it difficult for many depressed minors to receive treatment. Since the 2003 FDA warning of risks with pediatric cases, there have been, quote, significant reductions in aggregate rates of diagnosis and treatment of pediatric depression, according to the American Journal of Psychiatry. The fact is, a depressed person can't assume that professional help is available on demand, and this is especially true for minors. The things that can delay a recovery include difficulty in obtaining a diagnosis, the length of time before a medicine starts to work, and the problem of finding a mental health professional. If you want to see your doctor because you think you may be depressed, here are two suggestions. Instead of relying on the way you describe your feelings, bring facts with you to the doctor's office. Things that can be observed, like changes in your sleep and appetite, are as important in a diagnosis as how you feel. Along with your symptoms, write down important personal information, such as major stresses you've encountered recently. List all your medications, vitamins, and supplements. And it might be helpful if a family member came with you. The other suggestion is that you can get started with self-help. There are simple self-help methods that can at least contribute to your recovery. When things are especially bad, take things one at a time, a day at a time, a morning at a time, or even 5 minutes. A favorite movie or music can help. Many people get relief by going for a walk. Within reason, some extra food will lift your spirits, whereas alcohol, which makes depression worse, should be avoided. Don't isolate yourself. Talk with somebody, even if you don't feel like it. Stay in touch with your feelings. When you have an unpleasant mood shift, take 1 or 2 slow, deep breaths and examine the thought that just occurred to you in terms of its truth and its relevance to what you're doing at the moment. If you find yourself in a stressful situation, take slow, deep breaths until you're calm. Then think carefully about what to do. Exercise has been shown to reduce stress. The best exercise is the kind you enjoy, and sports are especially good because of the social activity. It may also be that people with depression who tend to remain indoors benefit from increased exposure to sunlight. Here are 3 self-help books, each one supported by scientific evidence. The Feeling Good Handbook, The Depression Cure, and Dying of Embarrassment. On the following slides, I'll show you details about these books and mention related books. There's a lot of text, but if it goes too fast, just stop the video until you finish reading. After the recommended readings, you'll see the references for this video.